Welcome to Field Ready Friday. We're in session 4. We're going to talk about the ACA Marketplace and the wrap up now that open enrollment is over. I am Danielle Byers. I'm one of the sales development managers here at NCC, and I work mainly with the ACA agents that want to sell it, either just ACA or ACA and Medicare. We have Julie and Angie on the call with us today, and we are going to go ahead and get started. So today we are going to focus on 3 key areas. We want to ensure that agents properly close out their ACA open enrollment business. We want to help you prevent retention issues, payment lapses, and terminations of contracts. We want to equip agents with a system for post-enrollment service, keeping engaged with your customers. And we want to position you and your clients for future cross-sell opportunities. So when I say closing out your marketplace business correctly and avoiding reconciliation issues, what I'm talking about is strengthening your post-open enrollment retention. That can mean quite a few things nowadays, a lot. 70% of enrollments require documentation to prove income, citizenship, loss of coverage, lots of different things. Before this year, they probably only made you send proof on about 10%. That is a big change for agents in what has to be collected. We're going to talk about leveraging your ACA book and helping you build a Turning 65 pipeline to help transition clients into Medicare when that's appropriate. And by the end of the session, I hope you will feel confident in how to wrap up your ACA cases and how to support your client book after their enrollments. And using that book of business for cross-selling opportunities, especially with Medicare. Let's get started with just a little chat. If you will pop in the chat, what was your biggest challenge this ACA season? And let's talk about some of the things that were challenges. I feel like for a lot of agents, it is getting the income sorted out. That is a big one, agents. There's a lot of confusion around what to include, who's part of the household, what income goes in there. So I always feel like that is a big challenge. Well, we're going to keep moving. And if you think of something later, please pop it in. We can always chat about that later on too. So let's talk about our carrier and our CMS reconciliation basics. So as we wrap up the ACA season, one of the most important things you can do is to make sure your cases are clean, accurate, and documented. This protects your commissions, and it also ensures that your clients avoid unexpected tax issues. So when you write a case and you have to put in their estimated income for the plan year, a lot of people don't know that. People that are 1099, people that are gig workers, they don't know their set income. They can't say, my salary is $40,000 a year. They just don't know. So it is very important that the clients reconcile that so they don't get a tax penalty when they file their taxes for 2026. So first of all, the most important thing is to verify that all of your enrollments were submitted successfully. What does that mean? So agents can use either their marketplace agent portal or their EDE, which could be Health Sherpa or another platform. But you can go in there and go through your client list and verify that each member shows that they have active coverage to the carrier that you enrolled them in. You need to make sure there aren't any documents required. It will tell you that in the platforms like Health Sherpa and Marketplace. And I mentioned this earlier, but income documents, citizenship documents, household status, Lots of things have to be downloaded now to the marketplace to verify. And if those are not done by the deadline they give you, which is normally 90 days, but if those are not done in time, the carriers have to cancel the policy. They don't give another chance. And if you get canceled for a reason like that, you cannot re-enroll a client because they will not have an active SEP. Not getting their documents in time does not qualify them for a new enrollment. So you should always think about cross-checking your carrier rosters, like your book of business reports with the carriers, against your internal CRM or any of your downlines reports to ensure that every client is accounted for. If you keep a CRM, if you use a spreadsheet, whatever you do, I suggest you go back and cross-check and make sure that everyone is showing issued and active. Please reach out to anyone that is matched, showing data match issue or pended or needs additional info. Those are all flags that show up. And like I said, those are time sensitive. You do only have 90 days in most cases to provide those items. All right, so let's talk about some tips for the reconciliation of your book. So you can pull your full book of business from the marketplace or Health Sherpa. As I said, you can also get that information from your carrier portals. You need to review your binder payment status. Binder payments are the #1 reason that clients lose their coverage. And non-payment of premium is another one of those sticky things that does not give them a new SEP. They would be without coverage and unable to enroll if they get termed for non-payment. You want to check for unmatched 1095A forms. Those always trigger a future tax issue. We're going to talk in a couple minutes about what the 1095A is and where it comes from. On HMO plans, you want to always verify your primary care provider assignment. Any plans that are HMO, different carriers will require you to have referrals. And if you don't have your primary care assignment in there, that can cause you grief when you want to see a kind of a specialist and you don't have the referral in place. So the last thing we're going to talk about is scheduling client follow-ups to meet with those clients and help them with their outstanding verifications. So it's important to reinforce to your clients that if they reported their income at $40,000 and it's June and they're going to make 20 or they're going to make 80, they need to turn those numbers into the marketplace and get their income amounts reconciled so that they don't have a chargeback. They have not fully enforced chargebacks to this point of ACA, but that is one of the things the government has been mentioning, that they are going to start reconciling those and get full 100% clawback of anything over. Honestly, I don't know if that is going to happen, but I would rather my clients be ready and reported correctly than taking a chance on having a clawback of any overpaid subsidy money. So once your book is clean and validated, the next step is making sure that those newly enrolled clients want to stick with you. But one thing quick before I go on, a 1095A is the form that the marketplace provides your insureds. They have until mid-February to get it out each year. It does not come from the carrier. It actually comes from the marketplace. When your clients file their income tax return, they need that form. It originally started because there was a penalty placed on clients that didn't prove they had qualified coverage. Nowadays, it is a way that the government and the marketplace verifies the income. So that 1095A form includes their monthly premium, the advanced premium tax credit or subsidy amount, and also the cost of the second lowest silver plan in their region. The reason that is important is that's the number that is calculated to figure how much subsidy someone gets. So that form is used when you file your taxes. You'll hear the term unmatched 1095A. Unmatched can mean two things. It can mean you didn't provide your 1095A information when you filed your income taxes, or it can also mean that the dollar amounts you did report don't match what the IRS actually has. The reason that happens is if you had multiple 1095As and you didn't include all of them. So let's say you were on an ACA plan from January to March, and then you went to an employer plan, and then you went back to the marketplace later in the year, you would receive two different 1095As, and you need to include all of those on your tax return. All right, so post-open enrollment retention, that one is a mouthful for some reason. That basically means your client retention in ACA. That is very important. Your client retention prevents you from having any chargebacks on commission. It also reduces your load for servicing clients. It helps protect your renewals. And it also builds trust with your clients that you kept their policy active, you let them know when something was needed, and helps with collecting referrals because the clients trust that you are looking to take care of them and you didn't just come on here to sell them something and then disappear. All right, so let's talk about the first 60 days. This is the highest risk window of losing your customers. And I sound a little like a broken record, but some of the biggest reasons clients fall off is they missed their binder payment. They didn't understand how their deductible or copays work. They had income changes they didn't report. They didn't know how to use the plan. And they also didn't complete the eligibility verification. So the best way to protect yourself and your client is to start with a simple welcome call or even a welcome email. Also set expectations with the client for how to use their plan, what will arrive in the mail, what they'll get, like their ID cards, their policy documents, and when they should call you or when they should actually call the 800 number on their ID card and talk to the carrier. It's important that you encourage clients to register on their carrier portals. This helps reduce billing issues. It helps reduce ID card calls. There are so many things a client can see when they're in their portal. I go into my portal constantly to look at EOBs to make sure when I get bills from different facilities that it matches what the carrier told me I was supposed to pay. You always should instruct your clients never to pay a medical bill until they've matched it to the EOB, because getting a refund back when you've paid something too early is never easy. But all of those things can be seen in the portal. They can look up doctors. Like I said, they can pay their bill. Most carriers have an electronic ID card. So, your kid's at college in another state and he doesn't have his insurance card with him, you can teach him how to log in and get that information electronically if they have to see a doctor and you're not with them to provide the card. So we talked a second ago about a welcome email, a text, a call. So in the first couple weeks after open enrollment ends, which is generally January 15th, open enrollment ends for ACA, but it's good to create a 30, 60, and 90-day communication plan. So that means touch your client about once a month. So on the 30-day check, you can confirm they got their ID cards. Make sure they got their premium set up on auto draft if that is something they wanted. Make sure they got their primary care doctors chosen if they're on a plan that requires that. Even if their plan doesn't require that, some people don't have a primary care, and it's good to help them learn how to find one, because once they're sick and need it, they don't want to be digging around trying to find somebody that takes a new patient in their area. At your 60-day check, you can check for any billing issues. Talk to them again to make sure their auto pay got set up. Review their usage questions. Why did I get such a big bill at the doctor? Why did the pharmacy charge me this amount? How are my wellness visits covered? All of those things are good to review with them so they're not surprised when they go to the doctor. And then at the 90-day, ensure that they understand how to utilize their preventative care. That's covered 100%. There's no reason not to do it. How urgent care works if they want to go to a walk-in clinic. And also, a lot of plans nowadays have virtual visits. And a lot of carriers have a zero charge if you use virtual because it is a lot less expensive on the doctor and the insurance carrier side for a virtual visit than if you actually went into their office. So all of those things are important to make sure they know how to use it and they're getting the most out of what they're spending their monthly premiums on. Let's talk about further out. So week 4, you want to confirm the coverage is active. The reason for that is to make sure their premiums got paid right. If someone gets a subsidy, the government pays that portion, but if there's anything over that, the customer's responsible for that. As I said, the PCP confirmation, and then talking about the benefits again. In months 2 and 3, ask if they've had any income or household changes. Educate them on when they can use an SEP if they do have any changes. Something like that, they have a new baby, or they got married, or they lost someone in the family, somebody aged out. Some of those things will give them an election period to allow them to not just take a person off or add a person, but also to make changes in what plan they chose. Someone with a high deductible plan has a baby, they're probably going to want to change to a copay plan if they can afford it, because you take young children to the doctor quite a bit more often, and they probably weren't thinking about all of those changes when they picked their plan originally. You also want to help them prevent tax-related issues by talking about the 1095A we talked about a few minutes ago. And then in months 4 through 6, you want to, again, review their status, introduce ancillary options to them. Do you need dental? Do you need vision? How about an accident plan or a hospital indemnity plan? We even have 2 plan options now that are hospital indemnity targeted to the under 65 market. A lot of Medicare agents are familiar with hospital indemnity plans and how they can help cover your out-of-pockets. But we have them now to work with these ACA plans. So it's always good for your clients to know all the different things you offer. If they don't know you have it and you've never mentioned it to them, it's likely they're going to go to someone else and ask questions thinking you don't have it. So always present to them all their options. It is in their court to tell you yes or no, I don't want that, but they should know that you have that available to them. Be sure in your CRM that you document every touch point with the client. It gives you stickiness, they call it. It improves client loyalty. If they are used to hearing from you every 30 or 60 days, they don't forget who you are. They don't go to a different agent at Open Enrollment because they couldn't remember who enrolled them last year. If they've not heard from you since last November, they might not even remember who to go back to. So if you are proactive with your clients, they are less likely to churn. They're less likely to change agents, especially clients who switch carriers every year or have an unstable income and have difficulty paying their premiums. It is a good thing if you're reaching out to them more so they know you are there to help them and they don't just go to the first person they come across on the internet for a new quote. All right, so these are some common post-open enrollment issues. So my premium changed. Why is my premium different than what you quoted me? So as an agent, you can check their income, check that they still qualify for the same cost sharing tier if they got that. Verify their household size. Another common issue is my doctor's not covered. You can verify network. That can be done on the carrier portals, and you can assist them with their PCP choice. I got a tax letter. What am I supposed to do with this? You can guide them about updating income and uploading documents. Who to reach out to. In any of the federal states, they can reach out to the marketplace. But if you're somewhere like Georgia, Virginia, Kentucky, those are considered state-based, and you have to reach out to those state platforms and not to the federal platforms. So what about I can't afford my plan anymore? You can help them evaluate if their change in income has given them a special election period to lower their plan so the premium's not as much. You might also help and screen them to see if they qualify for any kind of low-income subsidy, TennCare in Tennessee or Medicaid in some other states. There are plenty of other things you can do to help them when they call you up with some of these common issues. All right, so cross-selling movement from Marketplace to Medicare. Let's talk about the strategy, how to turn your ACA book into long-term Medicare customers. So every ACA agent is sitting on a gold mine of future Medicare clients. Your book contains those approaching 63 to 64 and a half. You should be talking to your customers and letting them know you do Medicare, at least by the age of 63, because they get bombarded. And if they know you and trust you, they won't need to look elsewhere or answer a call that comes in from an 800 number. Clients on the marketplace, but they are Medicare eligible. You all have those people that turned 65, became eligible for Medicare, but just never moved. You need to watch out for those because that is a big tax consequence if they were still receiving a subsidy. What about your customers who are disabled under the age of 65, but still on the marketplace? Once they've been disabled their 2 years and get their Part B, A and B, you're going to want to move them to Medicare because that will be much cheaper for them. And then also spouses or parents of your marketplace clients. They are a great lead source also. So one of the biggest advantages of having an ACA book is that it gives you a perfect turning 65 pipeline. The clients know you, they trust you, and they know they can rely on you. So that gives you a head start in guiding them into Medicare. All right, so these are some things in your turning 65 identification system you should be watching for, but agents should tag all their clients that are turning 63 to 65, track their birthdays, add them to a T65 education sequence, send them information about what happens when you turn 65. I would begin my outreach to clients 6 to 9 months before Medicare eligibility. Just like I said, they are being bombarded. So the sooner you let them know that you have the ability to help them, the better off you are. So tools to recommend. There is a turning 65 timeline explainer you can help them with. You can get them invites to a Medicare 101 webinar. Some people don't even understand what changes at 65 and what Part A and Part B mean. A lot of that stuff you can educate them on, but you can also help them find education elsewhere. I would recommend you doing it yourself just as part of the relationship builder, but also send them a link to schedule an appointment so you can talk to them closer. There are so many different things hitting them. Their mailbox is full. It's better if it comes from somebody they trust. Okay, so here's just a little cross-selling script that we have that you can use up to 120 days before. So here, hi, Mr. Redford, I'm reaching out because you're coming up on Medicare eligibility soon. Since I already help you with your marketplace coverage, I also help clients with Medicare. I'd like to walk you through what Medicare looks like and help you compare your options. Can we set up a quick call? Or do you want to meet face to face? I can come out and see you and explain to you all these things that are happening. Okay, so let's talk about some compliance do's and don'ts. This is a high-level overview, but do educate early. Don't steer them or pressure them. Do compare the ACA coverage with the Medicare options fairly. Do not terminate their marketplace coverage without confirming their Medicare start date, and always document their decisions. If they tell you no, or I want to wait, or I'm not ready, I'm just going to stay where I am, you need to be sure you have documents of that, even if you're just making notes of your conversation. Just because things get confused, people forget. And documenting their client's decision is always the most important thing. This isn't ACA 101, but I do teach that in ACA 101, that you need to document everything they tell you, especially their income numbers and their household information, so they can't come back later with a chargeback saying you didn't educate them correctly or you didn't key in how they told you. I always suggest when you have them sign the client authorization form before you enroll them, that you put those income and household size numbers on there so they have signed off that they are not only giving you authorization, but those were their numbers. So before we close out today, here are a few other little steps. Be sure and clean up and reconcile your ACA book. Verify your enrollments, resolve pending issues, document. Launch your 30, 60, 90-day retention plan. Build your T65 list to begin your Medicare Pipeline outreach. And if you are consistent with implementing these steps, it will help you retain more clients, reduce administrative fire drills. We all know what that is. Your client calls up angry, and you are having to put out fires all over to help them be happy, but also to fix their issues so they trust you and want to work with you, and to set yourself up for a stronger Medicare season. All right, so some action items. I think I just said most of these, but reconcile your book by the end of the first month. Complete your effectuation checks, meaning everybody's paid their premium. Implement your 60-day post-enrollment workflow. Pull a list of all your T65 clients and begin your outreach. Okay, I see there's a couple notes in the chat. I'm going to read those and answer. We can also come off mute if anyone wants to ask any questions, but also here are our whole sales development team. Everybody's contact is on here, and if you have questions, you can reach out to them or you can reach out to me. We all work together, so we're happy to help you. I see there is a question about, will this recording be available? Yes, it will. We will get it posted probably in the next week or so, Shelby. But you and I can meet too and talk about some of the stuff you missed. Talked to an agent yesterday and we talked about some really great ideas. She's working with some church ministry. She works in food banks. This not as part of her insurance business, but just as part of her passion for helping people. All those places are great places to get your name out, that you're there to help people. So it is really a free-for-all come open enrollment. So based on how well you set yourself up ahead of time is how many you can write in a day. Okay, so you can see our contact information is up there. Like I said, you can reach out to me. You can reach out to any of the sales development team. We are all here. We are all happy to help you, especially anybody that's wanting help. We're going to have we're going to start back our new agent onboarding series. So we'll have ACA 101 for those people that are new. I even have that recorded as a video. It's on our YouTube channel, or I can email you a link. So please reach out. I am happy to help. I can help with Health Sherpa. I can help with what are the rules of ACA? How do I get contracted? How do I certify? All of those things, we are here to help you.
Hi, Danielle. I'd like to share something.
Hey, Shelby.
Hey, hello, everyone. One of the things that we've been doing at our agency that's new, because we're new to all of it, we've been partnering up with tax preparers, and it's faring out to be a good thing because all of the tax preparers we know are actually talking to their clients or having to talk to their clients about whether or not they had gotten a subsidy and did they receive the form. And we've had a couple of them that are asking the question and asking them if they have a health insurance agent and or who helped them enroll. And whenever they say that they, didn't use a health insurance agent or anything, then they refer them over to us. And so we've been able to get, a few people that way. Now, I don't have any success stories in saying, how well it worked out, but I can say that the referral pipeline is working out. And so the rest is up to us to be able to turn that into something else. But I just thought that I'd share that with everyone.
That is a great one, Shelby. And the other thing to feed off of that is financial planners, because they are also helping their customers with what's my modified adjusted gross towards my subsidy. How am I planning for the future? So with the tax preparation, I always say H&R Block, any of those, if you have local mom and pop accountants that do taxes. I'm in Knoxville, Tennessee, and there's this one little tax office that at tax time, there is a line around the door. I don't know why they don't have an appointment, but their parking lot is packed and they have a line, and that would be a great place for an agent to partner with somebody. But yes, thank you. That is a great one. Okay, well, I'm going to let you guys have the rest of your day back. I hope it's a beautiful Friday where you are and not too cold. But please reach out if anybody needs us. We are always here and ready to help. Have a good day, everybody.